999 road activated.
One of the main things you do as a paramedic is go to environments that we can't control. There's always a sense of intrepidation as you approach. If we can get on top of things faster, that is going to save some lives.
"5G is a cutting-edge technology. It's mainly focused on mobile, and it's got three major characteristics: speeds above 1 gigabit per second, massive connectivity, and the third one is low latency. In healthcare, we can imagine live transmission and sharing across two different locations between a clinician and a medic.
5G to us in healthcare is much more than just a faster 4G. It allows us for the first time to use high-definition video to transmit images of patients, images of their conditions, and also we could use it to transmit high-definition images of an ultrasound.
It's amazing how people started working together, and in a couple of months, we had the first ultrasound test that we did over 5G. We have now, a connected ambulance and capability to do a real-time diagnosis.
I place the haptic glove on my hand, I do my ultrasound as I would anyway. "Doc, I'm wondering if I could run something by you for a minute." The physician moves the joystick left, it will vibrate, and I'll move my hand left. In the back of the ambulance, we also have a 180-degree camera. Using the virtual reality headset, the doctor back in the hospital can see a view of the back of the ambulance. That's directly linked to the ultrasound and the vital statistics. Using the augmented reality headset, I can show them what I'm actually looking at. Zoom 2. It's all audio commands, so I'm not even touching the headset. The 5G project is essentially like having an entire specialty suite within one environment. I can already phone them, but if we can get on top of things out in the community faster, it'll free up beds.
And in this particular case, in which the patient is bleeding into their tummy from their liver, allows us to make sure that they come to the right hospital at the right time, so if necessary, they can go straight into liver surgery.
It takes 15 years plus to train doctors to do some of the stuff we do here. The ability to increase the capacity of our workforce is limited by the length of time of their training. There's a huge area where technology can simply fill that gap.
I think it will be a game changer. I think it will be part of a process in which the NHS and other healthcare systems start to move into adopting new technology to improve the delivery of healthcare to very large numbers of patients.
5G opens a new culture of collaboration to transform these industries. It's not just to do it differently, but it's to provide more added value.
Without embracing technology, there is simply no way we're going to keep up with demands being placed on the service.
Midwives, district nurses, pharmacists, they're all able to benefit from this 5G network, ultimately delivering better healthcare and making a big difference to more people's lives.
So the engagement with the companies delivering the connectivity is hugely important. It is the only reason that we've come as far as we have, both in terms of what we've already done, but certainly in terms of what the world could look like in a few years' time.
Using the 5G network of BT, we are transforming the way that healthcare is provided, and we want the Queen Elizabeth University Hospital of Birmingham to be the lighthouse for the UK and for the NHS.